Hey everybody, hope you're doing well today. Today we are going to cover the blood vessel lab. So, um, let's take a look in our lab manual, and I'm just going to kind of follow along in the lab manual and point out everything that I can on each of these slides. Here is our first slide. This is not in our lab manual, and so this is something that I've given you on Blackboard that's already labeled. And I'm just going to point these out since they're already labeled. This should be fairly simple. Right here is the beginning of the aorta. We can kind of see this is where the heart has been cut away. So this is the base of the aorta, and so this is the ascending aorta. And then we see the curving component is the aortic arch. And we have the three big branches that branch superior off of the aortic arch. And then we bend and we become the descending aorta. But I don't want us to ever use the term descending aorta again in this class. I want us to be more specific. And so this is the descending aorta in the thoracic area. And so we call this the thoracic aorta. If we follow it over to our next picture, here is that aorta puncturing through the diaphragm. Here we can kind of see the diaphragm doming up. So here's the aorta puncturing through the diaphragm and becoming the abdominal aorta. Now we're going to see the abdominal aorta is going to split down here into our right common iliac artery and our left common iliac artery. And so let's kind of go back up and let's cover the thoracic region, but I just want to go ahead and cover all of that aorta and kind of point it out. We'll come back to that image and point those out again as well. So coming off of the aortic arch, we have the three main vessels that are supplying blood to the arms and the head. This first vessel that comes off is called the brachiocephalic artery or the brachiocephalic trunk. Either way, I kind of prefer brachiocephalic artery. That's more traditional. And it branches, and one branch heads out under the collarbone and out to the arm. And this branch is called the right subclavian artery. And eventually in the armpit, it's going to become the axillary artery. We don't really see it, but imagine if the armpit is out here, then it's going to become the axillary artery. Then it's going to enter into the upper arm, and it's going to become the brachial artery, right? So we'll see some other images to demonstrate that. The brachiocephalic artery, again, it came up, the first branch off of the aortic arch, and the branch that heads out to the arm, again, was the right subclavian artery. The other branch that heads up is the right common carotid artery. Now, anytime we see the word common, if it's an artery, that means that it's going to split into two other branches, or two or more other branches, or if it's a vein, it means that it's collecting from two or more branches or splits. So this is a common carotid artery that's heading up, and it's going to supply the inside and the outside of the skull with blood. This is going to help supply the right side of the head overall with blood, the right common carotid. When we get up here, we see it splitting. Don't let this trick you. Medial and lateral is not the same thing as internal versus external. So don't allow that to trip you up, okay? This one can appear to be more medial, but it's not the internal, because this is actually going to the outside of the skull. This is the right external carotid artery, and you can always find the external carotid arteries because of this extra little vessel right here. And it's not labeled here, but it's labeled on this side. This is called the superior thyroid artery. The superior thyroid artery always connects to the external carotid artery on either side of the body. So again, we came up this right common carotid. We have a branch, the right external carotid, that heads up to the outside of the skull, to the face and the scalp, and hanging off of it is that superior thyroid artery that we can kind of see as a little telltale sign, okay? Now the other branch that's heading up, this actually goes through the carotid canal or the carotid foramen in the skull, and it then plugs almost directly into the brain. And so this is our right internal carotid artery, sending blood to the inside of the skull, the right side of the brain. And then we're going to see that this middle branch coming off the aortic arch has that exact same mirror image. Okay, so this middle branch coming up, instead of having a brachiocephalic for the left side, we just take these two, the subclavian and the common carotid for the left side, and we put them up individually instead of combined. And so as a result, we see this left common carotid artery heading up to the left side of the head. And again, find our superior thyroid artery, and that attaches to our left external carotid artery. And the other one by default has to be the left internal carotid artery. Okay. These are some pretty major branches off of this the aorta, and so they're again supplying the left side of the head, either on the outside with the external or the inside with the internal. Now, the last branch coming off of the aortic arch is the left subclavian vein. Again, goes under the collarbone. That's how it gets its name, subclavian. And then it heads out, and eventually, remember, if you imagine the armpits out here, that's axial, and then into the upper arm is brachial, and even down into the lower arm where it becomes radial and ulnar arteries before it becomes the digital arteries in the fingers. And so we'll see some other images to point that out. We also see these intercostal arteries. I see that on our list under descending aorta for me. And so here is the intercostal artery, and right beside it are the intercostal veins. It's kind of pointed out, both of them right here. On the test, I'll either ask for the artery or the vein if I want to test you on that one. Okay, so it looks like we have gotten most of these terms. Again, for me, it's number 5B under right subclavian. It lists right axillary artery. I want you to give yourself a note that we'll ID that on the arm image. Okay, same thing if we move down, we're going to see, for me, it's number 9, left axillary artery. And give yourself a note also for that one. We're going to see that on the arm image instead. Well, I'll show you that here in just a second. Now, the two vertebral arteries, the right vertebral artery and the left vertebral artery, for me, it's 5A is the right vertebral artery and 8 is the left vertebral artery. I want you just to give yourself a quick note about those. The vertebrals are the first superior branch off of subclavians. So we find the subclavians, and the first branch going up is our vertebral artery. So here's our subclavian, and here's our first artery that's going up. It's going superior. There is our right vertebral artery, and here is our left subclavian. There's our first branch. So there is the left vertebral artery heading up. These are going to head up through the transverse foramen of the cervical vertebrae, and these also, if you notice, are always going to be accompanied by this nerve right here. And that nerve, you don't have to label it, but that is your vagus nerve. That's our cranial nerve number 10, that vagus nerve that had that extensive visceral input. And so here we can even kind of see, that's another way to remember these on this image, is that they're going to be right beside that vagus nerve. So again, these go up through the transverse foramen of the cervical vertebrae, and then these enter into the skull, and they help supply blood to the brain. So along with these internal carotids, there's 2 internal carotids and there's 2 vertebrals to kind of make sure that we have enough blood heading to the brain. Now, next, let's go to the abdominopelvic region. For me, I'm going to skip the head region for now, and I'm so sorry about that. And I'm going to go to the next page and cover the abdominopelvic region. So let's move forward to this one. You may need to zoom in while you're watching this in order to see this a little bit better. But here we can see the aorta, and the aorta comes out, and I would like to just go ahead and follow this aorta down, and then it becomes, we're going to look at number 27, 27A and 27B. So here's the aorta, and it heads down, and right here around your hip margin, it's going to split. So around your ilium, it's going to split, and it forms the common iliac arteries. Here is the right common iliac artery, and here is the left common iliac artery. And so these 2 arteries are going to split, head down into the pelvis and into the leg. If we look closely, each of these we can see, here's the right side. This one is the right external iliac artery. And near the ureter, we're going to see the right internal iliac artery. The internal iliac artery is going to help supply the right side of the pelvis with blood, and the external iliac artery is going to supply the right leg with blood. And then we have a mirror image over here on the left. We see the left common iliac artery, sorry about that, coming down, and then it's branching, and here we see the external iliac artery, the left external iliac artery heading down to the leg, and the left internal iliac artery heading into the left side of the pelvis itself, kind of towards the bladder, towards the end of the digestive tract and the reproductive area. Now, as we move back up, let's take a look at our list. I want you to notice that on our list under abdominopelvic region, we have unpaired vessels and we have paired vessels. So the unpaired vessels are obviously only going to be found in singles, and the paired vessels will be found in twos, in pairs. And so as a result, these guys are also listed from top to bottom. So in the list, the unpaired, the first unpaired is towards the top, and the last unpaired is towards the bottom of the aorta. And same thing with the paired. The first one's towards the top, and the last in the list is towards the bottom. So let's start up here towards the top. Let's do our unpaired first. It's really tough to see, but there's this very short section that comes out right here, right below the diaphragm, the aortic hiatus in the diaphragm. This is the celiac trunk. It really should have an O in it. Our textbook doesn't put an O in it, but that is wrong. It comes from the root word coelom, which means body cavity. So this is an important O to have. Celiac without the O means something completely different. And so unfortunately, our textbook has got this wrong. When we look at this, we can see the celiac trunk comes out, and this is not labeled. You need to label these two branches right here. These two branches are two important branches. This branch right here that goes out towards the right side is going to go out to that big brown organ heading to the liver. This is the common hepatic artery. So the right-hand fork of the celiac trunk, remember in anatomical position, we're talking right and left. And so here, this is the common hepatic artery. And this vessel heading out to the left is the splenic artery. It's going to head over here to the spleen and supply the spleen with blood. We can also see this one tiny one branching off in the middle, kind of. This one that branches off in the middle of the celiac trunk is kind of heading out here, and it's heading out towards the stomach. This tiny little vessel right above that adrenal and below the exit of the esophagus. So this vessel right here is called the left gastric artery. If you just put gastric artery, that'd be fine for me, but this is the left gastric artery. So again, the celiac trunk comes out. It's very short. It branches into the common hepatic artery, the splenic artery, and coming off of the celiac trunk, we have the left gastric artery. As we move down, our next unpaired is right below it. So here we can see the superior mesenteric artery. And so the superior mesenteric artery helps supply the beginning of the intestines. If we continue on down, we can see right here is the inferior mesenteric artery. And the inferior mesenteric artery helps supply blood towards the end of the intestines. Now, median sacral artery isn't the easiest to see, but if we come down right here at the branch at the bottom of the aorta, we can barely see this little vessel that's coming out in the middle of the common iliacs, and it actually goes behind that iliac vein, and it pops out right there. And so this vessel is called the median sacral artery. I'm not as likely to ask you this one on the test since it's so difficult to see and it's not labeled, but I did want to go ahead and cover it. Now, that takes care of our unpaired. Let's switch over and let's cover our paired arteries next. Again, let's start at the top. Here is that aortic hiatus. We can even see the bottom of the diaphragm and that hole. The first pair that comes out is right here at the very top. It's up above the celiac trunk. This pair is heading out, and it's going to kind of vascularize the bottom part of the diaphragm, and we can kind of see these vessels. These are called the inferior phrenic arteries. In the bottom, phrenic refers to diaphragm, so the bottom of the diaphragm, there's arteries, and that's what these two pairs are. Okay. Now, as we move down, it gets a little bit more complicated to see. We can see, and I can't really show you the right side very well. I don't really want to focus on the right side. We'll focus on the left side here for these arteries. Right here, we can see the vein a whole lot better, so I'd more likely ask the vein on the test, but I definitely want you to be able to identify the arteries as well. Right above this renal vein, we see this artery that's heading out to the kidney, and it kind of branches. This is the renal artery, or the left renal artery. And branching and up superiorly before you actually hit the kidney, there is the left adrenal artery. And so there's that adrenal gland. We can see that red vessel going up to the adrenal. There is the left adrenal artery. Now, again, the right side, I'm not too concerned about. These are very difficult to see. And I kind of like these veins a lot better. You can really see the renal veins. You can really see the adrenal veins. So I want you to be familiar with the arteries, but I may ask the questions more likely from the veins instead, just they're easier to tell the difference. As we move on down past this region, we get our next pair right here, this skinny, long whisker-looking structures. These are heading down into the pelvis to the gonads. So these are the right and left gonadal artery. If this were a male, these would correctly be called the testicular arteries. If this were a female, then this would correctly be called the ovarian arteries. Okay, and so as a result, if you want to give me any of those three for this, you're more than welcome to. If you'd rather stick to sex specific with testicular or ovarian arteries, that's fine. Or if you want to just go general with gonadal arteries, I would take either of those three on the test because they're all the same thing. And that finishes up our abdominopelvic region as far as the arteries. Now, let's move forward and let's take a look at the head region for the arteries. And then we'll look at the arm and the leg, and that will finish up the arteries for this lab. Again, this is our longest lab into 11. It's the most complicated. It's got the most things. So definitely it's going to take more time on the presentation, and it's also going to require more time for you to study. Now, when we look at this image out of the textbook, we can kind of see here's our brachiocephalic artery. We can see the right subclavian artery branching off, and then we can see the right common carotid artery heading up. We can identify real quick right here is an artery coming up from the thyroid. So there is our superior thyroid artery. And as a result, it attaches to this vessel right here, this branch off of the common carotid. This is the external carotid artery. Okay. Now on the test, I don't really care about sides for these. Just give me the names of the vessels and I'll be happy. So again, the common carotid comes up. The external branch is a little bit more forward in our image, and the internal branches backward. And I want you to pay attention to this. It disappears right here. It goes into the skull around that, near that mastoid process, and as a result it disappears. We don't see it anymore in our picture. So that's an easy way to remember. There's the internal carotid artery, and here is the external carotid artery. Now again, we've got branches off of the external carotid artery that we need to take a look at. The first branch that I've already mentioned is that superior thyroid artery. So this is the first branch that comes off of that external carotid. The second branch that comes off is this one right here that wraps underneath the mandible and then covers over much of the face. This is the facial artery. Okay, we skipped that artery. That's the lingual artery. It's not on our list, so I'm not going to cover it. But the next one above it is the facial artery that heads out and covers the face. As we move up, we get this vessel that branches backward underneath the mastoid process, and it kind of supplies the occipital region in the back of the skull with blood, the back of the scalp. This is the occipital artery, and it's the only one of these arteries that branches backwards off of the external carotid, so that's an easy way to remember it. As we move up a very short distance, we get this little one that's heading into the maxillary bone, into the maxillary region for your upper teeth, the gums, and some of that area. This is the maxillary artery. And at that point, after the maxillary artery, for us, everything that's above this, we're simply just going to consider it to be part of the superficial temporal artery. Okay, so everything that rises up past the maxillary artery is the superficial temporal artery. All right, so that took care of the external part of the head. Now let's take a look at the internal part of the head. Again, this is a posterior view. Down is back, up is forward, anterior is up, posterior is down. And so here we can even see the spinal cord coming in. When we look at this, we see these red vessels. It almost looks like there's a head. It looks like there's a body. Here's some legs. Some weird arms. And he's got some wicked little deer antlers and some odd looking ears, right? So that's kind of what we're seeing is this weird alien looking fella, right? Now, when we look at this, I want you to, let's start at the legs. The legs are another view of the vertebral arteries. And this is one of the better views that we have of these vertebral arteries. I know it seems that they didn't list them down here under branches. Well, it just says branches of the vertebral arteries, but you also need to know that these are the vertebral arteries. So these legs are the vertebral arteries. They merge and they form what's called the basilar artery. It's in a part of the skull called the basilar region. So here's the basilar artery, which is Stickman's body. And then his arms kind of come back and they're supplying the back parts of the cerebrum with blood. And so his arms are called the posterior cerebral arteries. If we look over here at this color coding, these arms are trying to be represented by the green, right? So these branches coming off here are the posterior cerebral arteries. Now, usually we enter the brain through these vessels right here, and they're very short. Okay, we've cut it, and then it's very short. This is the internal carotid artery. So the internal carotid artery is the one, again, that branches off of that common carotid, heads up through the carotid canal, the carotid foramen, and then plugs in right here. Now, once it hits the edges of Stickman's head, right, it becomes something different. Internal carotid until then, but after that point, right, after it becomes his ear, this is now the middle cerebral artery. And if you look at it, it's simply just taking blood out to the middle regions of the cerebrum. Here's the temporal lobe, parietal lobe, frontal lobe towards the back. And so this is the middle cerebral artery. These are kind of red in this image right here. I think that this is an older image and you guys have a newer view and it might be better color coded in your view, okay? Now, branching off of those middle cerebrals and interior carotids, we have these vessels, and this is really a little bit confusing. This red part right here should be the same blue as this, okay? These vessels come up and then they continue straight up. So this vessel comes up and it continues up to the front of the brain. This one comes up and it continues up. You notice this little connector in the middle at the top of his head, this is a different vessel altogether. So these two that make the sides of the head and his weird deer antlers, these are called the anterior cerebral arteries. And again, very well named because we're taking blood to the front of the cerebrum. That vessel in the middle that connects the two anterior cerebrals, anytime we connect cerebrals, we call that a communicating artery. So here we can see in between the two anterior cerebral arteries is the anterior communicating artery. And again, this is just kind of allowing the blood to flow through here. If there is a blockage somewhere, then this provides a little bit of a reroute, a way for us to make sure that we're going to try to get blood to all the regions, even if there's a blockage in some part. Okay, and now our last part that we need to learn are Stickman's cheeks, because we've already learned the rest of his body. But his cheeks, these little skinny guys, and they're purple on this image, these are the posterior communicating. Again, they connect the middle cerebrals to the posterior cerebrals, so these are going to be a form of communicating artery, and these are towards the back, so these are the posterior communicating arteries. Now, Stickman's head makes this circle. This is sometimes called the circle of Willis. It's also referred to as the cerebral arterial circle. And so you may see that term cerebral arterial circle or the circle of Willis. I like cerebral arterial circle. That's more descriptive. It's the circle of the arteries around the cerebrum, right, that supply the cerebrum. So that's a good way to think about it. Now, to finish up the arteries, we're going to cover the arms and the legs. Here's an image of the arm. Again, here is our subclavian artery. When we get to the armpit, it becomes the axillary artery. When we enter into the upper arm, it becomes the brachial artery. Whenever we get to the forearm, it splits. Thumb side is going to be our radial artery. Pinky side is going to be our ulnar artery. That shouldn't be tough for 211ers because we remember radius is thumb side, pinky is the ulna, right? And so it's just named after that. Then we see this connection right here, this curve, this arch. This is called the palmar arch. You don't have to talk about deep versus superficial. Let's just point out the superficial and the brighter one. And so this is the palmar arch that kind of connects those two vessels together. And off of the palmar arch, we have these that head out into the fingers. The fingers of the toes, the vessels, are called the digital arteries. So here we have our digital arteries. Let's take a look at the leg real quick before we switch over and cover our veins. Now that we've covered our arteries, our veins should be a lot easier, right? And so it shouldn't take us quite as long to cover the veins, and I don't think we have quite as many veins as well. Now, here we can see the common iliac branching into the internal iliac and the external iliac. When the external iliac goes past this inguinal ligament, past that line, and this is what creates the crease at your hip, right at the top of your leg. And this, once the vessel goes past this, it now becomes the femoral artery. So here we see the femoral artery, and this femoral artery is now coming down, and it's going to go behind the knee. And this is a little bit confusing, but behind the knee is always going to be popliteal. This is kind of tough to see. It's shadowed here to show you it's behind. This is a posterior view, so it's showing you that it's right there towards the back. So there's the popliteal or popliteal artery. Now, at this point, I'm going to simply ask you a couple of questions, and I'll point this out in lecture or in class as well. If I point to the front of my lower leg, and I ask, here's the front of my lower leg. If I point to the front of my lower leg, and I ask you what is the red vessel in the front of my lower leg, then that is the anterior tibial artery. If I ask you what is the vessel in the back of the lower leg, then that is the posterior tibial artery. So I'm just going to use those terms, front and back of lower leg, and that's going to cue you into either the anterior tibial or the posterior tibial artery. The last one that you would need is to the lateral side. So if I ask you which red vessel is on the lateral side, the outer side of the lower leg, and then that's going to be the fibular artery, because the fibula is lateral to the tibia, right? And we've learned that back a long time ago. Now, at that point, I don't care about dorsalis pedis artery. For me, that's number 37. I also don't care about the plantar arterial arches. We pointed out the arches in the hand. I'm not too concerned about in the foot, but I do want you to know that the digital arteries, again, are in the toes. They're in the fingers or toes. They're in your digits, right? So now that takes care of the arteries. Let's flip over and let's take a look very quickly. We've got about a page and a half of veins that we want to cover, okay? So here is our first vein image that we're going to start with, and this image shows us several of these from the thoracic region. So first off, I want you to notice right here is the right internal jugular vein. I'm going to show you a different image to make sure that you can see these in another view. But here's the right internal jugular vein bringing blood out from the inside of the skull. Here's the left internal jugular vein bringing blood back from the inside of the skull. These are going to merge with the left subclavian vein and your right subclavian vein, right? And again, these are coming from the arm. So we've drained the arm and we've drained the head, basically. And then these both are going to merge, and we're going to form two brachiocephalic veins. So now we have a right brachiocephalic vein and a left brachiocephalic vein, but we only had one brachiocephalic artery. So don't forget that and don't let that confuse you. The two brachiocephalic veins are going to merge, and they form that large tube that punctures into the right atrium, and there is the superior vena cava. Okay, so there's that superior vena cava. Now, at that point, let's take a look back at some of the very first pictures that we started with, right? So let's don't forget that in this view, we see the intercostal veins, and that's really the only vein that I want you to be familiar with here in this image. I'm not going to worry about the azygous or the hemiazygous vein, and so really the only vein in this image that you need to know are the intercostals. But here we have some other veins that you should be familiar with in the abdominopelvic region. These veins are, here is our inferior vena cava. Okay, so the inferior vena cava is formed from the right external iliac vein merging with the right internal iliac vein. And when the external iliac vein and the internal iliac vein on the right side merge, they form this vein right here. This is the right common iliac vein. Now, coming up from the left side, we've got a mirror image. We've got the left external iliac vein, and we've got the left internal iliac vein kind of hiding behind that ureter just a little bit. When these merge, they form the left common iliac vein, and then the two common iliac veins, the right and the left common iliac, merge, and they create the very bottom of the inferior vena cava. And that tube goes all the way up, punctures through the caval hiatus, and attaches into the bottom of the right atrium right up here. Okay? Now, we have abdominopelvic region. We've already done the internal, the external. We've done the common iliacs and the inferior vena cava. Next on my list are the adrenals. So let's do the renals first. Here is the left renal vein, and branching up off of it superiorly is the left adrenal vein. Again, over here, right renal vein, bringing blood back from the kidney. And here, branching from the superior portion, is the right adrenal vein, draining blood back from that adrenal gland. Maybe has adrenaline in it, who knows? And then we kind of see these whiskers, again, these long, skinny ones, thin ones. And here's one, and over here is another. And this one kind of attaches to a different place, not necessarily to the inferior vena cava, not that big a deal. This is the left gonadal vein, and here's the right gonadal vein. You can use testicular ovarian one more time for that one as well. When we get up to the top, these vessels at the top are the hepatic veins. These hepatic veins are draining blood out of the liver, and the liver is kind of the reset button for blood. So this is bringing kind of cleaned blood, right? It's been kind of filtered and cleaned through the liver, and it's kind of hit a reset button. So this is bringing some good clean blood back into the inferior vena cava right before we head up to the right atrium and then head out to the lungs to get oxygen. So it's kind of cleaned by the kidneys and by the liver, and then the liver adds nutrients, and then we go and we're going to hit the heart before we go grab that oxygen. The last branch off of the inferior vena cava is this little one right here. Now realize this is not a very good image for this. There should be as many veins as there are arteries underneath here, right, for this diaphragm, but they're only showing just one little branch, so don't let that confuse you. This one little branch is the inferior phrenic vein, and it should be just as vascular as the arteries, and there's actually more veins than arteries many times, and so here we can kind of see that. All right, there's that inferior phrenic vein, just a little example, so not to block other images there in the book. All right, now at that point, let's move forward and let's look at the head. So here we have the external region of the head, and when we look at this external jugular, first off, here's the brachiocephalic vein. We've got our subclavian vein over here, and then we're going to have two branches. I want you to notice we've really got three branches kind of coming from the skull, from the head. The first one, let's just go ahead and cover this. The first one's right in the middle, and here you can actually see it running up through the transverse foramen. And so that's the reason I want to go ahead and cover this one. The one that's wrapped with some bones every now and then is the vertebral vein. Okay, it doesn't matter about right or left for the test for this. As long as you have vertebral vein, I'll be happy. Okay, so there's the vertebral vein going through the vertebrae, right? That's an easy way to remember it. Then we've got this one. If you follow this one, it goes to the inside of the skull. If you follow this one, it branches and goes to the outside of the skull. Okay, so this bigger one is the internal jugular vein, bring blood back from the inside of the skull. And this skinnier one that does a whole lot of branching and kind of goes all over the place, this is the external jugular vein. Now, this image kind of shows a lot of these vessels branching off of the internal, not the external. And this to me is wrong. This is not what we see in most images, and I'm not sure why they drew it like this. Usually we say that these are branches off of the external jugular, but for some reason they drew these branches coming off of the internal jugular. So let's talk about some of these branches just real quick. First off, we see this vessel coming up from the thyroid. Again, superior thyroid artery. And then almost the same thing, wrapping around the mandible as the artery and covering most of the face. There is the facial vein. Again, back here, up here, coming into the maxillary region, kind of hidden, going a little shadow behind the mandible. There is the maxillary vein, bring blood back out of the maxilla and those sinuses in the upper jaw region. And at that point, everything else above it, draining from the scalp, the top of the scalp, we're just going to call it the superficial temporal vein. Okay, so we don't have quite as many of the veins in this region as we do arteries that we're going to cover. Now let's look at the inside of the skull. And this should be a refresher from 210 when we covered nervous system and we covered this material. These are sinuses, right? These are not necessarily veins because they're not draining blood. Some of these are draining cerebrospinal fluid. So we call them sinuses. They're pockets in the dural folds, in the dural septa. And so these dural sinuses are kind of listed a little bit differently. Instead of veins, we call them sinuses. And once they go out of the skull, then they become an actual vein, right? The internal jugular vein. So here, this one at the very top, that's running right down the middle, is the superior sagittal sinus. This is the main place that we recover that CSF. Below it, in the same curving, arcing pattern, inferior sagittal sinus. The inferior sagittal sinus merges with this little vessel, the great cerebral vein. You don't have to know that, but then it forms the straight sinus. So this is really the only one that's not curved, and that's why it's called the straight sinus. And the straight sinus comes back, and it connects the inferior sagittal sinus with the superior sagittal sinus. And now all of this fluid is flowing together, and then it wraps around the, well, actually, real quick, here is the occipital sinus. So we see this one coming up from below. Here's that occipital sinus, and the occipital sinus draining from the lower parts of the back of the skull, right? And that's kind of the occipital bone. They all merge, and then they go around the outsides of the, or they go around the inside of the skull, right? So this that goes around the inside of the skull, wrapping around, is called the transverse sinuses. These guys going out laterally. And then we see how it makes an S. When it makes that S, that becomes the sigmoid sinus. So here we see a sigmoid sinus. In the background back over here, we see a sigmoid sinus. And this sigmoid sinus, once it hits the inside of the jugular foramen, it changes its name. Once it exits the jugular foramen, the sigmoid sinus becomes the internal jugular vein. So it's actually the same vessel right here. It's just once it comes out of the skull, it's called internal jugular. Inside the skull, it's referred to as the sigmoid sinus. Okay, so that's a little confusing, but not all that complicated. Next, we have the hepatic portal system. The hepatic portal system is how we drain nutrients and we take it straight to the liver. I mentioned earlier in this presentation about the liver and those hepatic veins, and how the hepatic veins are putting kind of filtered and nutrient-rich blood back into circulation. So this is how all those nutrients get to the liver in the first place, so that they can be stored and be balanced and then put back into the blood flow later. When we look, first off, I want you to notice there's arrows that represent blood flow, but there's only 4 arrows on this image, and those 4 arrows are the 4 vessels that you need to know. So it's easy to connect them just with these arrows, and on the test I might even point at these arrows to kind of tell you which vessel I'm looking for. This vessel is bringing blood back from the beginning of the intestines, and that is the superior mesenteric vein. If you remember, the superior mesenteric artery took blood to the beginning of the intestines. So here's the vein. Here, bringing blood from the end of the intestines, is the inferior mesenteric vein. Now, the inferior mesenteric vein is going to merge with this blue vessel that's behind the stomach, and this vessel is connected to the spleen. So this is our splenic vein. And now that we've collected blood from inferior mesenteric into splenic vein, the splenic vein merges into the superior mesenteric vein, and it forms our last vein that we're going to talk about on this image. This is the hepatic portal vein. So the hepatic portal vein, again, we're taking capillaries in the intestines and we're sending it to capillaries in the liver. And remember, we talked about it with the hypothalamus and the anterior pituitary. If we connect two sets of capillaries, then we create what's called a portal system. And so there is the portal vein that connects the two sets of capillaries, and that's how it got its name. Now, to wrap this up, we've got arms and legs. These are much more difficult compared to the arteries because there's more of these overall. Here we have two different groupings. We've got the darker ones and we've got the lighter ones. I don't care if you know if they're superficial versus deep, but in your lab manual, these are grouped together by deep versus superficial, so you can use that. But let's start with the darker ones first, which are the deep veins. Here we even see, again, is the axillary vein. That's a good place to locate it. There's the axillary vein. And then we see coming down into the upper arm, and it branches into two branches. We have the brachial vein, and then it becomes the two brachial veins. Now, this is going to start to help bring blood back from both sides of the forearm. So as we get down here to the elbow, we're going to branch again. Each of those branches. So here, this one splits into two, and then this one splits into two. So now we've got a pair on the pinky side of ulnar veins, and we've got a pair on the thumb side of radial veins. So these are the darker blue colors, right? Make sure that you're keeping that straight in your brain. Now, we get to the palm, and we see the venous palmar arches. So here are the venous palmar arches. And again, heading back from the fingers, we have the digital veins. Now, let's cover those superficial veins as well. The superficial veins start in the forearm and they tend to go almost all the way up the arm. And so these are a little bit trickier overall, but they're also easier because as long as you can stay on one side of the arm, then here on the thumb side is the cephalic vein, and over here on the pinky side is the basilic vein. And again, it doesn't matter if we're in the forearm or in the upper arm, we're going to be called the same thing in either area. Now, what connects them right across your elbow, right across the antecubital region or the cubital region, is the median cubital vein. So here is the median cubital vein. This is the one that is usually used to take blood for venipuncture, right in the middle of your elbow. They kind of smack that thing to make it firm up, right? Make the muscles kind of constrict a little bit to make it show itself. And then they puncture into this to take blood, right? So there's that median cubital vein. Now, again, we're going to have to do lower legs similar to what we did on our previous arteries with the lower leg, but here we can do the upper leg from here. So we've got our common iliac vein, there's the internal iliac vein and the external iliac vein. Again, once we go past the inguinal ligament, that's when it becomes the femoral vein. Okay, but now we've got a lot more branching, like I said. So here is the femoral vein, but we also have this deep femoral vein right beside it. So don't be confused by that. The only one that I'm going to ask really, the main one in the thigh, the deep one, the darker one, is the femoral vein. Now this is going to go down, and behind the knee it becomes the popliteal or popliteal vein, and then it goes down into the lower leg. And I'm going to repeat what I did with arteries for the lower leg with veins, except for I'm just going to call them blue vessels instead. Now there's an extra vessel here that we do need to pay attention to, and it actually starts down here towards the ankle, and it goes all the way up on the medial side. You notice this is the medial side, okay, towards the midline. This vessel is called the great saphenous vein. It's kind of like one of those superficial, like the basilic and cephalic for the arm, but here this is going medial side from bottom all the way to top, the great saphenous vein. Now, the lesser saphenous vein, I'm not going to make you know for this test, so you can mark out the lesser saphenous vein. Again, you can mark out plantar venous arches. That's this curved region right here, but I'm not too concerned. You can show it to me in the hand instead. Of course, we got digitals in the toes again, and then that basically leaves us with 3 more vessels. Now, again, on the test, I may just hoist my foot up onto a desk and just point towards the front of my lower leg and just tell you, what is the blue vessel right here? And you would tell me in the front of my lower leg, that's the anterior tibial vein. If I point to the back of my lower leg and ask you what that blue vessel is, then that would be the posterior tibial vein. If I point to the side of my lower leg, the outside of my lower leg, right, then that's going to be the fibular vein. And so I'm going to point to my own body for those on the test more than likely, just to make that component a little bit easier, because these pictures are really confusing trying to pick all these guys out down here. All right. Now at that point, that completes all of our blood vessels. This is the majority of what's going to be on our lab test. So it's a good idea for you to go ahead and start studying these blood vessels and get them in your memory, because the lymphatic system is our second component, and there's maybe 20 terms or so that we've got to learn for lymphatic. So it's not very big. It's kind of like our endocrine chapter. It's just small and quick and short and easy. But again, this is a little bit more complicated. What I notice on our lab tests every semester when we get to the blood vessels is that people get right and left confused. And unfortunately, if you get right and left confused, I've got to count it wrong, because you're telling me the wrong vessel, right? So it's not a simple half off. It's a completely wrong answer. So you've got to make sure that you get your rights and your lefts down, okay? The other thing is that you don't forget to put artery or vein. So many people will write and they'll start writing answers and they just don't put artery and vein, and I've got to count half off for that at least. And so if I just see common carotid, well, I need a side and I need a vessel at the end. So that's completely wrong, because you missed 2 out of the 4 components, right? So make sure you're focused and you're putting sides when necessary. You're also making sure to add the ending artery or vein, okay? And then you've also got to make sure that you got those words in the middle. Some of them we've got like commons, we've got internals, we got externals, and so we've got even more descriptors to describe these words. So a lot of our blood vessels have 4 terms: left, common, carotid, artery, right? So right there, you've got 4 chances to mess that term up on a test. So practice this. You've really got to practice. You've got to be extra confident in your information, that you understand it. And so practice this to the point where it is second nature and you know this by heart. It's not something that you've memorized and you're going to get the words confused quickly, So start focusing on this, spend a couple hours a night on your studying, and that should get you to where you want to be for our next test. All right. If you haven't started studying for the lab, after you've watched this, then you're starting to get behind. So you definitely need to get that process going. All right. If you guys have any questions, please feel free to contact me, and I will be more than happy to help you out. Otherwise, I hope everybody has a wonderful day. Thanks a lot, y'all.